Hey, this is Robbie Stahl from the Fitness Doctor, and I'm here today with Tad. And Tad is one of the clinic directors here at Select Physical Therapy. Now, Trent Nestler, who had a huge part in helping me develop our biomechanical optimization system, he is the National Director of Sports Medicine for Select Medical. And Tad runs the clinic here in North Scottsdale, Arizona. So today we want to talk about the fusion of physical therapy, people getting injured and trying to get the most out of their body, and then having injuries happen. What do you do about those injuries? And how do you take the things you learn in therapy and fuse that into fitness to where you really create a system where you no longer have to deal with those injuries and you drastically decrease the risk of injury? So not only help and fix the injuries, but drastically decrease your risk that it will happen again in the future. So Ted, when it comes to therapy and injury, and I know of course it's different joint by joint, but what would you say is really the biggest thing that makes a huge difference in people dealing with an injury and getting past that injury? Because, I mean, I've been injured before. I've torn my ACL. For me, that was such a serious injury. I felt like I might not ever walk again. It was so painful afterward. And when people are in that position, what kind of advice do you give them?
I think one of the biggest things that I see that can help someone in therapy is confidence. A lot of people come into therapy, they're hurting, they do not know what the future is going to hold as far as, hey, am I going to get back to my activity? Am I going to get back to work? Am I going to get back to my sport? As a therapist, we kind of play part psychologist as well. We're not only here to address their range of motion complaints, their strength loss, their functional loss, but also give them kind of that peace of mind that yes, you will get back to your sport, you will get back to work, you will get back to your extracurricular activities. Staying positive with patients, giving them that positive feedback, the encouragement to get back to where they ultimately want to go. That's probably one of the biggest things as a therapy provider that we can do for the patients.
So Ted, from the point of injury to the time that someone would begin physical therapy to aftercare, what do you feel the ideal process is? And of course, this is going to change based on type of injury, but talk to me a little bit about that.
Well, as a therapist, we're just a small kind of cog in the wheel of the whole healthcare continuum. It all starts when someone gets hurt and they're going to go to see a doctor, and whether that patient, has to have a surgery or they get referred to physical therapy. Depending on what the doctor sees fit, we'll see the patient, and our job is to get rid of their pain, improve their range of motion, improve their strength, try to get them back to work, sport, whatever activity they're looking to get back to. As a physical therapist, we can only take them so far. A lot of times people are looking for more than that. They want to get back to a level of a function that is higher than a rehab process will allow. And that's where kind of an aftercare program, the fitness doctor, would come into play, is we would take a patient, take them as far as we could in therapy and rehab, and then transition them to appropriate fitness program.
That's interesting because, I see therapy do so well. People go from broken, basically, to where they can't function. They're completely dysfunctional. Their physical life is literally removed. And in a very short period of time, I've seen that your patients be able to progress tremendously. But I know that, like insurance providers, the one paying the bill usually for the patient's care, they'll only pay for you guys to treat that actual injury. And I know you and Todd, being as high level as you guys are, I know you, of course, would want to address the issue holistically. So what does someone do with that? Because I know that you know that doing the whole spectrum and dealing with the whole function is so important. But yet at the same time, if they're injured and they have a serious injury, they need to get past that specific debilitation. So,
well, that's where a lot of the time you will come into play. As a therapist, like I said, nowadays nowadays we're kind of limited by insurance. At some point, way back when, we could treat a patient whenever. We see them for so many visits now, and then basically the insurance is like, okay, it's time for you to go and get out there on your own. Like I said, we take them as far as we can go, and then after that, it's their job to either continue with a home program, where a lot of times people are non-compliant. They don't do their stuff at home, or they basically become, like I said, kind of lazy and forget to do their stuff. Transition them to a fitness-based program based on biomechanical, evaluation assessment is key for them to make sure they're doing their exercises properly. Like I said, we can take them from point A to an even higher level of function by transitioning them to a fitness expert like yourself.
So if your patients were watching this, what would you say to them specifically about, okay, I completed therapy, now how do I really optimize my body? Like, what would you say?
Ideally, it doesn't stop when they're done with therapy. They truly need to do something after the fact in order to get the most out of a surgery or a rehabilitation program. Like I said, I truly encourage them to seek an outside expert to take them the rest of the way. If we give them 90%, that last 10%, go see someone, like I said, as yourself, where they can really do a good job, where we trust you, we know that you're going to do a good job, you've come very highly recommended, you're very well trained. We don't just send our patients to anyone. We want to send them to the best. We want to send someone that knows what they're doing, someone that's we're confident in, that will do a good job and take them the rest of the way.
Absolutely. One interesting thing, Tad, is between all the things that you guys offer and all the things that we do, I mean, we can take a person that's completely broken and make them absolutely amazingly fit, even Olympic level. And it's because they followed through with the actions that you give them, the therapies you provide, the actions that we give them, and the things that we provide them. It's the compliance that's so very important.
I couldn't agree 100% more with you. That's probably the biggest challenge that we see in physical therapy is compliance, especially when we go to discharge a patient. We can hammer to them the importance of doing a home exercise program, to continuing their care, but a lot of times people need that little extra push, shove. They need someone there to assist them, to kind of be there to make them compliant, to make them own up to the sacrifices and the things they've done already in therapy. And like I said, that's where you would come into play. A person of your expertise in nature, we value the relationship that we have sending people to you, because we know that you're going to do a very strong biomechanical assessment of them. You're going to give them what they need to get the rest of the way. I kind of refer to myself a lot of times, if I was working construction, building a house, therapy, we can take them 80% of the way, but like I said, if we do not have the roofer come in and put the roof on, we've not completed the job. Any other, I guess, system in play, would you do something, half the effort? No, you want to get them back to 100% normal. And in healthcare, right now, it's just it's a very solid transition when they go from therapy to a fitness expert, and continue to do the job.
That makes perfect sense. Yeah, absolutely. So when it comes to making your body awesome, even if you are broken at the time, I hope you've gained a lot from what Tad and I have just talked about. And if you have any questions for either of us, feel free to drop your comments or questions below or private message me, and I'll make sure that we get back to you right away. And remember, it's up to you to make it a great day and a healthy day.